think the important consideration is to make sure that the patient has an accurate diagnosis. In some research that was presented, they found that patients with ILD didn't have idiopathic pulmonary fibrosis, but they had other types of ILDs. So it's important in the workup to make sure that they get blood work that would determine if there's any other like mixed connective tissue disease or any autoimmune components. So I think that the workup is really the critical part here to get to the proper diagnosis. Some considerations in this population is that you want to address frailty and also look at if the patient has other comorbidities. These interact together to cause symptoms for patients, and their symptom experience may be different, but our goals are to make sure they achieve the best quality of life. And so part of that is addressing symptom burden and using palliative care, early use of palliative care to help provide symptom management to reduce this burden. And the second part of palliative care, the consideration is that you also want to address advanced care planning to find out what is the goals that this patient has as their disease progresses. And more importantly, do they have a decision maker, and is their decision maker aware of what their goals are? And it's important to note it's not set in stone, and it can be readdressed at several time points across the disease.